Welcome. My name is Niall Boyce and I'm the head of field building in mental health at the Wellcome Trust. Of course, the Wellcome Trust, we now have our own mental health challenge area where our vision is a world where no one is held back by mental health problems. We're pursuing this aim through a combination of projects, including building the field, looking into the causes of mental health problems, and also looking at new pharmacological and non-pharmacological treatments. That's just our side of things. We're going to hear about all kinds of activities today in this webinar to mark the run-up to World Mental Health Day. So you're most welcome wherever you are to this webinar. And it's a particularly special one this year because this year marks 10 years since the first World Mental Health Day on October the 10th, 1992. Now, of course, one of the big differences between the world of 1992 and the world of today is that today we have the technology to connect as a truly global mental health community. And these webinars, which have been running since 2020, are a really great example of that. So it's very appropriate that the theme for this year's World Mental Health Day is making mental health and well-being for all a global priority. So what we're going to do in this webinar is highlight the work being done around World Mental Health Day. We're also going to encourage everyone here to collaborate and to support each other among the many members of the Global Mental Health Action Network. And of course, anyone else who's present, anyone else who's interested. So if you're online and you want to contribute, say to our Q&A, please feel free to put some messages in the chat. And when you go into the chat, do say who you are and do say where you're joining our conversation from. The other thing to say is that if you go into the chat, you will find a link to the Global Mental Health Action Network Global Moments Google Sheet. And that is essentially a great big compilation of all sorts of activities happening around World Mental Health Day. And if you have something to contribute, I would encourage you to do so. Please do. Now, without any further ado, I'm going to ask our fantastic panel to introduce themselves. What we're going to have is a round of questions, firstly on the global picture, and then we'll have a few questions from you, the audience. What we'll then do is look at one sort of national example, and then we'll have further discussion. So this will take around an hour. And as I say, I would really love to see your contributions to this discussion. But to start off, I'll just ask our panel to introduce themselves. And starting from my screen on the left, Emma.
Thank you, Niall, and good morning, good afternoon, good evening, everyone who is joining us. I'll carry on. There's just a tiny little feedback. My name is Emma Ferguson. I am a global mental health advocacy specialist with UNICEF headquarters in New York, and it's my great pleasure to be with you today and this fantastic panel.
Thank you. Aditya.
Thank you, Niall. Hi, everyone. My name is Aditya. I am from Indonesia, from Yakkum Rehabilitation Center, an organization which work to advocate and to assist persons with psychosocial disabilities, as well as to work in the cross-faith issues in Indonesia. Nice to be here with you all.
Thank you. Dr. Nasser, would you like to introduce yourself? You'll have to take yourself off mute.
Off mute, there we are. Right, yes, my name is Nasser Loza. I'm a psychiatrist. I'm based in Egypt. I believe the reason I'm on this distinguished panel is that I'm currently president of the World Federation for Mental Health. You know, I'll tell you more about this when I make my brief contribution. But it's really a delight to be invited with you today, and I really value this collaboration from the Federation and this distinguished team. Thank you.
Thank you. Gary.
Greetings, everyone. My name is Gary Belkin. I'm here because I've been honored to be in the middle of starting a great growing network and organization of people working on the issues and the intersections between climate change and mental health. We call it copsquared.org or cop2.org. I'm going to fill in more on this a little later, but it's great to be here and to bring this issue to wider mobilized interest in making global mental health more mainstreamed into global policy.
Thank you. And finally, Dan.
Thanks, Niall. Hi, everybody. Good to see everyone. My name is Dan Chisholm, and I'm a mental health specialist at the Department of Mental Health and Substance Use at WHO headquarters, and waving from a rather rainy Geneva today.
Thank you very much. So we're joining from all over the world, and just glancing at the chat, I'm seeing people are joining from South Africa, from Kenya, from Bangladesh, from the UK. It's just a fantastic thing to see so many people from so many different places here to discuss this topic. What I'd like to do, though, to start is turn to Nasser. Dr. Nasser, what is the World Federation for Mental Health Planning for World Mental Health Day, and where can people find more information about this?
Right, I'm going to try and make this brief, but basically we're not a very young organization. We were born in 1948, together with the modern United Nations and WHO. And for a long time, we were in fact the mental health arm of WHO. But as an organization, we were born with a mission that we're going to support the needs of people and mental health needs of societies. They're helping people with mental health issues, improving services. And therefore, we're not an organization of clinicians. We're not about treatment. We're much more about advocacy. We're much more about anti-stigma work. We're much more about including professionals and psychiatrists, psychologists, but most of all, of people with lived experiences and carers, so this really what we do. And 1948 is when we were born, but World Mental Health Day is much more recent than that, and we're looking more like 1994, when the World Federation for Mental Health took over the responsibility of choosing the theme of World Mental Health Day every year on October 10th. And it's been an evolving work and contribution. We've gone a long way from having a board of professionals who would propose a theme with valid arguments to a much more democratic people sharing into the choice of what World Mental Health Day would be about. So this is exactly what we do at the Federation. Our mission when we started was to support mental health needs around the world. But there was another part of our mission that I'd love to review, because I don't think we've done very well on that one. In 1948, the world was coming out of the Second World War, and people seemed to believe that mental health leaders could bring countries, societies, and citizens of the world to live together with no more wars. Remember, this is why the United Nations came into power at the time. And that conference in London, 1948, King George in London wrote to the conference saying, "We count on you to bring the citizens of the world to live in peace together." I don't think we've achieved that one, but the other part that supports people with mental health, I think we've done well on that, yes.
Thank you. So it seems that with your organization, although world peace has proved unattainable, it is nevertheless the case that you see mental health as being sort of deeply embedded with social and political concerns.
Absolutely, absolutely. Yeah.
So where can people find out more about the World Federation for Mental Health and your activities around World Mental Health Day?
Well, I mean, there's plenty online, obviously, on our website. And there's plenty online about the website specifically for World Mental Health Day. But as we're coming closer to October 10th, there is a huge number of organizations globally that are doing regional activities. Our regional vice presidents are doing that. I know a bit more about the region where I live, but I mean, Lebanon is a leader. Egypt is doing a lot. There is a lot of activities and awareness online. Remember, this year's theme for World Mental Health Day is mental health and globally around the world, but well-being comes into it as well. And that's the first time the world of well-being is coming into the theme of World Mental Health Day. We're living in a challenging world today, and societies need that support. And if we prioritize well-being, then we go beyond people with mental health difficulties, but actually, the society as a whole in well-being. So yes, we're online, but by all means, please write to us. We'll supply you with more information. Wherever you are around the world, our regional vice presidents are well supported. We've got a small amount of funding to help with the activities. So I expect this year we'll be seeing a lot more as well. Yeah.
So with the World Federation for Mental Health, what specifically is your organization focusing on?
Well, we are now focusing on spreading the message of the needs of communities and societies for supports in mental health. We're bringing in well-being as a priority, but we're not here just to treat people with mental health disorders or otherwise, but rather the well-being of societies on the whole. So this is what we're doing, and we're doing that through many channels, including a lot online, obviously, because the last few years have forced us to do that, and it's been a successful experience on the whole. And so there'd be a lot of webinars and podcasts, and there are a number of meetings with community leaders as well. We have found at the Federation a long time ago that it's all very well inviting somebody like Nasser Loza to talk about the needs of people with mental health. You'll have a few people listening. Nowadays, you call them followers. And it's interesting. But then if you bring someone with a lived experience of mental illness, it goes much further. People listen a lot more and trust people with lived experience, which is the way it should be. But then we've also learned that the best of all is to bring some famous politician or a leader to talk about personal experience with mental health. If you can find that, then you've combined the best of both worlds. Even better than politicians are famous actors and musicians and pop singers. Everyone listens to those. But what tops everything is football player. If you live in a country where there's a football player who's happy to talk about theirs or their loved one's experience with mental health difficulties and stress, then you've topped everyone.
Thank you very much. So I will then, to extend the metaphor, pass the ball to Dan from WHO. So Dan, what is WHO doing for World Mental Health Day?
Thanks, Niall, and very good to hear from Nasser to sort of set the scene and the context. So I've got five things to mention in no particular order: a campaign, a forum, a summit, a report, and a commission. So I'll quickly mention those so you can see where I'm going based on those five keywords. So like every other year, WHO has a dedicated campaign in the run-up to World Mental Health Day, which is entirely complementary to and in support of the theme that is chosen by the Federation, which of course for this year is making mental health and well-being for all a global priority. And through this campaign, like others, we seek to raise awareness, understanding, and promote action on mental health. And specifically, we use our network of both regional and country offices. We've got around 150 around the world, as well as, of course, international partners and collaborators like everyone on the call today, to leverage the messaging and organize local events or activities to commemorate World Mental Health Day. And we specifically, we provide templates and posters, talking points to our heads of offices. We've also got a couple of new short videos, one on stigma and one on suicide this year. So, I mean, this year's theme is a very broad one, which I think has the advantage of enabling all of us in the global mental health community to bring in different perspectives or emphases. But actually, this year's theme really fit very well with the main message and tagline, in fact, of WHO's new World Mental Health Report, which is called Transforming Mental Health for All. So very similar kind of point, you know, there. This has been 2 years in the making, and the first such report by WHO in over 20 years. The last one was in 2001, the World Health Report. And I'm not going to go into it, but I mean, just to kind of give you something, the report, I mean, lots of case studies and activities that people can do, but the three main kind of pathways to transformation that we're concluding with, I can just mention. One is around deepening the value and commitment to mental health, so a call to everybody to understand and appreciate mental health, but also around inclusion of people with mental health conditions in all aspects of decision making and in society more generally. The second one is around the determinants of mental health, which of course shape mental health and well-being, as Nasser's correctly, you know, pointing out. And so of course that could be determinants that both protect or risk adversely our mental health. And we're talking about home environments, school environments, the community, and the workplace. So that's the second one. Just as an aside, this is nothing to do with today's, but tomorrow, there just to make people aware, there is a publication of new WHO guidelines on mental health at work, which will provide some evidence-based recommendations on how to improve mental health at work. So one to look out for tomorrow. The third and final of those transformation pathways is around the system, the mental health care system, to ensuring access to everyone in need. So this is more like the universal health coverage concept in action. I mention all this because we're going to base our annual mental health forum around some of those key themes. That's been held on World Mental Health Day on the 10th, as well as on the 11th of October. And this is an annual event that's been going on maybe around 10 or so years, bringing together stakeholders from member states, civil society, academia, other actors in the mental health space to exchange ideas, collaborate, and learn from each other. So we've got a full agenda this year. It's not too late to register your interest in attending. You can do that by writing an email to mhforum@who.int. Now, a very special thing is happening at the beginning of this year's forum, and that's the launch of a new Lancet Commission on Ending Stigma and Discrimination in Mental Health. Niall, you've seen any number of commissions from the Lancet in your time, but this one's going to be the best ever, right? It's reviewed the evidence on effective interventions around stigma and calling for immediate action by governments, international agencies, employers, healthcare providers, the media, and people with experience to work together on eliminating stigma. So the objectives of this event will be to present the report. We'll have the main commissioners, Charlene Sunkel and Graham Thornycroft, and hear some responses and reactions and how different stakeholders will respond. You can definitely easily join this event by going to the United's website under events, and you can register your interest in joining us for that on World Mental Health Day. The final thing was the Global Mental Health Summit. So this is in a way perhaps the grandest of the events taking place in that week, because this is ministerial level meeting. It's about the fourth in a row. We've had the UK, we've had France, we've had the Netherlands, now Italy will be hosting it on the 13th and 14th of October. The focus, perhaps not surprisingly given Italy's history, is on community mental health, but it will be also covering topics around workforce, capacity building, migration, child and adolescent mental health, and innovation. This isn't, of course, a WHO event, but we have been offering support to the organizers of the summit, and we'll be taking part in those discussions. So again, there should be a website that Divya could perhaps share so you can find out a bit more about that. So enough from me, back to you, Niall.
Thank you. That's a whole range of activities, and it's a good job that we're recording this webinar, so viewers will be able to play back and to catch all of that detail. But for now, I'm just going to hand over to Emma from UNICEF and ask Emma, what is UNICEF planning?
Thank you, Niall. And just quickly before I dive in, just to provide a little bit of context. So last year in 2021, UNICEF launched our global advocacy strategy on mental health, running until 2025. This also kind of coincided in the public launch of our State of the World's Children report in October of 2021, which we can't believe is almost a year ago now. The advocacy strategy covers the full kind of continuum of mental health, but really has a big focus on prevention and promotion in early childhood and throughout adolescence, and really tries to aim to ensure that children and young people are part of the global discourse on mental health. So in parallel, last year, we also launched our On My Mind campaign, which really aims to engage the public and harness the power of young people and their caregivers and their voice and their action to really kind of drive change around mental health. So this year's World Mental Health Day at the global level, we are planning a new On My Mind campaign activation that will launch on the 10th of October, linking both to the theme of mental health for all as a global priority, but also focusing on the topic of stigma, as we've heard from Dan, linking to the Lancet Commission on Stigma and Discrimination. So in particular with this activation, we'll be looking at how we can build acceptance in ourselves and our communities and enhance understanding of mental health and begin to change the conversation around mental health and dismantle that stigma and discrimination at all levels. So a couple of highlights. Our activation will include a few new videos, one including a UNICEF Goodwill Ambassador, going back to Dr. Nasser's point about the importance of these kind of role models, really modeling that behavior of talking about mental health. We'll have a couple of other influencer pieces, which we're really excited to share. We'll have a comprehensive social media pack with expert advice, tips, and some new animated content. We've also got a fantastic series launching featuring youth advocates on mental health from Nepal, Zimbabwe, Jamaica, and the US, which will start launching on the run-up to World Mental Health Day. And we will have a chatbot which will be going live on our YouReport channel. So this is really aimed for young people directly, but providing tips and skills for young people on how to build self-acceptance, as I mentioned, and really talk about mental health in a way that is accurate, helpful to themselves and others, and non-stigmatizing, importantly. And then we'll have a lot of other content on our webpage and our parenting hub around from the 10th of October. So there's a lot going on. We can share a social media pack for partners probably within about the next week. And then I would just encourage you to keep looking out on our channels from the 10th of October. And please do share and utilize all of that content for your audiences if you can. Two other things to flag, perhaps more tools than reports, but one thing I wanted to mention is that UNICEF's Office of Research in Adolescent, based in Italy, will be launching on the 10th of October an evidence and gap map with an accompanying report and research brief. So this is really based on a mapping of the effectiveness of mental health and psychosocial support interventions for children and adolescents over the last 12 years. This will be launched on the 10th of October, and we hope this will be a very useful tool to support not only UNICEF's advocacy and programme work on mental health, but others in the field of mental health to support, in highlighting the gaps and where more research is needed to support mental health programming and advocacy work. The other thing to mention is we will be also launching a data collection tool to measure adolescent mental health at the population level. So this will really allow for generation of data on different aspects of adolescent mental health, including the prevalence of symptoms of key conditions like depression and anxiety, suicidality, care seeking, and more. So we'll be working with our country counterparts initially to provide guidance and technical support on the rollout and implementation of this tool, which will also include kind of further data collection, capacity building, data use and dissemination. But we would encourage partners to reach out to us if you are interested in this tool and how we might be able to collaborate. And then lastly, Dan has mentioned these 2 points already, but we will be supporting the launch of the Lancet Commission on Stigma and Discrimination at the World Mental Health Forum. And we will be working alongside WHO colleagues at the Global Mental Health Summit in Rome on the 13th and 14th of October, really looking to ensure that there's a kind of clear focus on child and adolescent and caregiver mental health throughout the agenda, and in particular in the technical working group session that we will co-lead with WHO colleagues. So we're very excited for that as well. Thank you, Niall. I think that's everything from me.
Thank you, Emma. And a very positive response to all of the panelists, to judge from the thumbs up and hearts that I've seen floating up my screen while you were talking, and a round of applause there. Thank you very much. But we also have some questions before we move on to the next part of the webinar. And this is a question from Harun, who is from ADD International Bangladesh. And Harun asks, is there any working relationship between the World Federation for Mental Health and WHO? And the second part of that is, how can we engage more with the activities of the World Federation and WHO in relation to the improvement of mental health in countries like Bangladesh? So I'm going to give that over first to Dr. Nasser.
Right. Well, yes, thank you very much for bringing this up. The short answer is yes, a very positive working relationship. This meeting I attended anyway before the pandemic, before the lockdown, was in fact in Geneva. And no, we work very well together. And, you know, the mental health division of WHO and the Federation have met regularly. And at the London meeting of the World Congress of Psychiatry in London, there was a very active participation of WHO with us. It's exchanging support and exchanging ideas. That's so, you know, we work hard to come up with a topic of, well, you know, World Mental Health Day. WHO is tremendously supportive on that and sort of puts it up and makes it a reality, and people using it around the world. So yes, there is a lot there. Yes, thank you for asking.
Thank you. Dan, do you have anything to add to that from WHO's point of view?
No, I think that's covered it well. There's a good relationship, and we're in constant contact with each other. Maybe I'll just address the second part of the question was around the support, you know, that people can give at a country level. And in fact, Bangladesh is one of the countries that's part of WHO's special initiative on mental health. This is a kind of large scale up at country level, supporting the governments in their efforts to develop policies and services. So in Bangladesh, ambitious plans to roll out district level mental health services and increase access. So I mean, as an organization, you know, WHO is so-called member state organization. So that's our kind of primary relationship is with the member states, the countries. But of course, when it comes to country level implementation, particularly, we're looking at you know, a whole conglomeration of actors on the ground who can and are involved, because as we know, you know, you can't do this just through the health sector alone. It requires multi-sectoral approach and action, not just in terms of kind of, you know, going beyond health, but also in terms of going beyond the government or formal sector, incorporating also academic partners, NGO, people with lived experience, service user organizations, and so on. So there's lots of ways to be involved in country level activities which I think was the question.
Yes, and that ties in with the next question, actually, which is kind of along the same themes, with same sort of theme with a very specific focus. And this question says, it would be great if the panel can guide us on how regional organizations can participate in these campaigns and provide opportunities for youth to advocate for better mental health. So specifically, the involvement of youth, I think, is something which would be interesting to hear about. I don't know, Dr. Nasser, if you can answer that.
Very positively, really. Your investment of time and effort and funding where it's needed goes much further with the youth. For one point, they are more capable of changing their minds than the oldest part of the population. They listen, they will adapt. They're probably going to live longer than the older one of us, so they will have a stronger impact. The best way I found to do that, if you want to send a message or a campaign with a strong message, is inviting students and even at school or high schools or colleges to write a campaign, to invent their own campaign, to participate and think about it. And we've done that in many countries. We propose a small prize to the best mental health campaign from all the mass comm departments of all the universities or from all the high schools. And then you get a large group of young people thinking, how would they do it? Very impactful. So yes, thank you for asking that. It's a much better investment, young people. Yeah. Thank you.
And of course, the issue of youth mental health, I think, is really indivisible from the issue of global mental health, because although you might not believe it to read in the mental health journals, which focus on youth mental health in high-income countries, 80% of what we call the youth who are vulnerable to mental health problems, of course, live in low and middle-income countries. And the majority of people who have severe mental health problems will normally develop them in that period of youth. So this is an absolutely vital group to get involved, wouldn't you say, Dan?
I would agree with that, and I would agree with that, and I'd love to see on a more global level youth participating with us in voicing the need for support for youth mental health. It is a priority. Perhaps that's something we should be thinking about for the theme of World Mental Health Day in 2023.
Thank you. Dan, do you have anything to add on that?
The advocacy starts now. And often this topic is proposed as the focus for a World Mental Health Day, a report, a meeting. It is so paramount important. And just think about the demographics. When you look at the age structure of high-income countries versus let's say low-income countries, very, very different, right? Due to not, like you have a large percentage, nearly half the population under the age of say 20, 25. So this just means that it has to command the highest attention because it affects so many different facets of life. Your work life, your home life, your life as a member of the community, and so on. So yeah. We will have other webinars, no doubt, on this topic soon. But maybe Emma wants to chip in as well with something on that.
Thank you, Dan. No, I mean, we would be very supportive of that from the UNICEF side. I think it's a great question. I mean, really just to highlight what we know, I think Niall, you've touched on this, but we know that over half of mental health conditions develop by the age of 14 and 3/4 by the age of 25. So we're talking about a really important kind of window of opportunity to prevent poor mental health and promote good mental health in childhood and adolescence. And that's really why UNICEF's advocacy work focuses on those early years. We're really calling for much greater support for parents and caregivers, particularly to support positive nurturing care and mental health in the earliest years, and really looking at ways to promote good mental health in the school and community that we know are such kind of important places for children and young people. Just going back to the question of how to engage young people in this advocacy work, I think it's a great point. I would just really highlight that the need to kind of invest in young people. Young people are fantastic advocates on this issue, but they shouldn't have to kind of shoulder that burden alone and be exposed perhaps to environments that they are not wholly prepared for. As UNICEF, we are definitely trying to really kind of build skills and capacity for our youth advocates so that they are better able to use their voice and their power to change policies, to change behaviours on this topic, but importantly that they don't feel that they're doing this alone, that they have the support and the skills that they need to do that.
Thank you very much, and thanks for the questions so far. I see there are one or two more, but we'll get around to them later on in the webinar. But for now, I'm going to turn to Aditya. Now, you're based in Indonesia, and I wonder if you can tell us at the national level what you're planning to do this World Mental Health Day and why, and also how can people get involved?
Yeah, thank you, Niall. In this World Mental Health Day 2022, we are plan to conduct the religious mental health declaration. Since we think that in Indonesia, religious play big roles in our community. Since the stigma about mental health, especially about the suicides, many people or religious community thinks that commit suicide or thinking about suicide is a sin, and we as a human cannot do it, and something like that. That's why in this year we collaborate with several religious leaders in Indonesia to develop religious mental health declarations. So later on we can make or develop the religious norms on how to support each other, and if doing suicide or commit suicide is a sin, so help people for not doing it is a good deeds to do. That's the concept of what we will develop later on. And based off that, we also want to reduce stigma and discrimination, especially for people with mental health conditions, since it coming back since in Indonesia the religious play big roles, and people are very believe on the religious leader and the God things and something like that. And that's why through this later on we can also spread the declarations to religious community and to the grassroots level, and they can also say it in the weekly pray, for the example, so people can support each other and can be more aware for the mental health issues. And in the big events, we will conduct the declarations in Jakarta, in the capital city in Indonesia, with the starts and end with us events. In that moment, we will collect 5 religious leaders in Indonesia to declare their support on the mental health, and to declare the statement on the professional help seeking, as well as abolish the religious stigma, which are individuals with mental health are morally or religiously weaker, something like that. In this event also, we also plan to invite more than 2,000 people in order to break Guinness World Record for the world largest mental health awareness lesson, since we are not only to declare about the religious mental health, but to invite as many as people to be aware and to be able to support each other mental health, so everyone is mentally mental health fit, something like that. I think that's the plan that we will do, Niall. And later on, the declaration will be available also in English, and I will share it through the Global Mental Health Advocacy Network group as well. So later on, you guys can use it in your own country as well to do the awareness on the mental health using the religious point of view.
So that's fantastic.
Thank you,
Besides everything else, we have the opportunity to become record breakers as well. That's brilliant. If you have a web link, if you could pop that in the chat, that would be fantastic. I'm just going to briefly turn to Gary. Gary, you mentioned earlier that you're doing some work around mental health and climate change.
Yes, great. And, you know, as many people on the call probably also experienced the first World Mental Health Day, the fact that we're at this point in just 10 years with just this proliferation of work, for me, it's becoming more than World Mental Health Day, it's becoming World Mental Health Day week. And so it's really extraordinary. And so I've increasingly gotten involved with the intersections of climate change and mental health. Climate change policy at a global level has really been talking about hardware, infrastructure, energy shifts, transportation systems, food systems, and so forth. And so a lot of us have been talking about, and now there's a growing organization, copsquared.org or cop2.org, that is now over 100 organizations strong in terms of groups working on this intersection between climate and mental health, and talking about the human infrastructure, the social infrastructure, the emotional resilience that we all, or this, what we've been calling the social climate, that we also have to take care of. And we've made, in just a few months, remarkable inroads into getting that attention within, to start with, the UNFCCC's COP process. And so people may not be familiar with all of those acronyms. But COP is an annual meeting of nation states to talk about their agreements to reduce emissions and so forth. But it's also a huge mobilization of civil society to also act. And that work is led by high-level champions. And they have agreed to include mental health into what they call the race to resilience. And that race to resilience is to really hugely mobilize global action around adaptation work. It's been focusing more on, again, physical infrastructure. And we made the point that you need resilient people to have resilient places. And so the tentative plan is to have some sort of attention to this add to the race to resilience, whose aim is to reach 4 billion people by 2030. So to have mental health in that stream of work is very exciting and important. So at COP27, to announce that intention, and that copsquared.org is going to coordinate a strategy, a roadmap of how to get there through race to resilience to deliver by COP28. So we are scrambling excitedly to grow that community of interest and to develop a consultation process that includes everyone on this webinar and everyone you may know and everyone they may know. We really want this to be a highly participatory, consultative process. We're really starting to sketch, the machinery for that, the approach for that. So this is really a first large announcement of that intention and purpose. We are really excited to start a first run of dialogues on World Mental Health Day and during that week in each global region. So we invite organizations, people who are representing organizations, to come to that first run of feedback about what this roadmap should include. To sign on, you can learn more about us and sign in as a member to get more information about your region's dialogue during World Mental Health Day week through cop2.org. And we really want to grow this community and this input and really reach those 4 billion by 2030.
Thank you very much, Gary. Now we have a little time for a couple more questions. And the first question on my screen is from Joanna, who asks, what are the group's joint objectives and hopes in terms of the output of the Global Ministerial Summit? So there might have been a little bleep on my computer there, so I'll just repeat that. What are the group's joint objectives and hopes in terms of the output of the Global Ministerial Summit? I wonder if we could start, Dr. Nasser, with you. You're muted, sorry.
All right.
Yep.
Yeah. Well, the globes and objectives are ambitious, and you know, we don't think we're going to achieve that very fast, but we're getting there. Essentially, a very strong word of advocacy for people globally. There's been the response to World Mental Health Day every year has been increasing. The messages are heard and people are adopting. I was very excited by looking at, as it was just mentioned a moment ago, the Guinness records and who's there. So I've gone online as you were talking, and there is in fact a large number of organizations competing with large numbers of attending. So the system is working. And so, yes, these are our aspirations, to be heard, to bring people on board, young people, mental health of youth, priorities set. And I think this is having an impact, and it's having an impact directly for people who work with it, but it's having an impact indirectly. I've been in this field for some 40 years, and I'm finding now that most countries, particularly developing countries around the world, who want to review their mental health laws, for example, they used to take years for governments and parliaments to set that as a priority. We had to have sorted out all the problems of the economy and of politics, and then we'll look at mental health. It's not the case anymore. Mental health advocates around the world, when they want to be heard, they are heard much faster. So that is our ambition and our dream, to continue in that direction.
Thank you. Emma, what are your hopes for the summit?
I think I would say, building on Dr. Nasser's point, really moving from we've seen fantastic increase in awareness and conversation around mental health, particularly in the last few years. And I think these summits can be a really important, a space for us to move that conversation into action. I think as a group and as a community, really looking at some of the key accelerators that we know are kind of evidence-based and can ensure lifelong good mental health, but that also link to economic, educational outcomes. So that's really, I think, what these summits can do, and I think we're excited for Rome, but already kind of thinking about how do we build that momentum into the next summit and into the future summits as well.
Thank you. Dan, what are your hopes for the summit?
Well, I don't know after the recent elections, but I think the critical thing about these summits is that they are aimed at ministers. Okay, so most of the discussions, meetings we have are like this, together as a community, or it could be a national meeting. The idea behind these summit of ministers is to enable them to hear from each other, their peers, if you like, in other countries. I think there are something like 40 delegations expected in Rome. So it's a real opportunity for people at that high level of decision making. Some of them may be relatively new to that, health portfolio and ministry. So it's a fantastic opportunity to network, to meet other people, to hear, to understand, and hear from the technical people about what they see as the critical, the needs, the priorities. So it's about pitching it as policy messages that can be acted upon, which is a bit different to like a research conference or something like that. So if pitched right, these summits come up with a statement, a summit declaration or conclusion, and this can be used by all of us, to hold those parties to account to some extent at least, and say, well, this is what was said, this is what was agreed, this is what was declared. So let's see more action, in the countries where we're all working. So that's my hope, is that that the words lead to action on the ground.
Thank you. Aditya, what would you like to see from your perspective coming out of this summit?
Yeah, for me, I think it will be great if we can see each other action and sharing each other from the ministry perspective, and later on, hopefully, it can also implemented by us in the grassroots level, since the global policies or in the policies in the high level or ministerial level, sometimes it is hard to be implemented in the grassroots level. So we really hope that later on, if there is any policies or law that made by ministerial level or people in the global level, it can be also easily implemented for us in the grassroots level.
Thank you. And finally, Gary, I'll adapt the question a bit for you. Would you like to see mental health and climate change sort of joining together a bit in terms of policy at this summit?
Well, of course, and I think that fuels the larger intersectional argument that was mentioned, that mental health is, yes, about closing gaps, about addressing unmet need, but it's also about improving school outcomes and improving economic outcomes and improving readiness and resilience and social cohesion to do the really hard work and to cope with the devastating changes of climate change. That mental health is an investment that's a multi-solving one. And so that is the sort of thing that I think resonates, but isn't heard enough by this level of governance. So this is really a critical opportunity.
Thank you. So we are unbelievably almost at the end of this webinar. I've been keeping an eye on the chat screen, which has been scrolling like the beginning of a Star Wars film with all sorts of amazing messages and resources and activities. But I'd like to simplify things a bit for the last few minutes here. And I'd like the panel to answer this question individually and at tweet length. Think of it as an elevator pitch, but for a very short elevator journey. And the question is, can you complete this sentence? And the sentence is very simple. It's this World Mental Health Day. We all need to. So I'm going to ask Emma to start off.
Thank you, Niall. This World Mental Health Day, we all need to take collective action, invest, connect and speak up to help tackle mental health stigmas and discrimination, and ensure every child, adolescent and caregiver can realise their right to good mental health and well-being.
Thank you. I think that was even under 280 characters. So I'm going to pass over to Dan.
That's 2 tweets. I've gone for even less characters. Similar message though, this World Mental Health Day, we all need to be speaking with a united voice about what can and must be done to transform mental health for all. Thank you. Gary.
I feel like the other guys were prepped on this question. So this World Mental Health Day, we need to affirm that it's not just no health without mental health, it's really no social progress without mental health.
Thank you. Aditya.
In this World Mental Health Day, we all need to work together, take action with as many people as possible to work on mental health.
Thank you. And finally, Dr. Nasser. You need to unmute again.
Sorry, I do this every time. What I'm hoping we'll be doing this year is really loudly and proudly continue the messages of World Mental Health Days on previous years. This year, there's a strong message that it isn't just about the needs of people with mental health disorders. It's also about well-being. It's about all of us. It's about societies, maybe not as ambitious as the 1948 sort of countries, but at least societies should be able to live together and a better quality of life, prioritizing their sense of well-being, dealing with weather and campaigns and differences and religious problems that they have among each other. People should learn to live in peace and should learn to live in a world where it prioritizes well-being on every level.
Thank you. And I think the start of that process is communication. And it's been fantastic to see the links today among the panelists and in the chat. And I'm looking forward to seeing the outcomes of the conversations which have been started today. And indeed, the first reflection on the outcomes and successful activities for World Mental Health Day 2022 will be the subject of the next webinar, which will be on the 25th of October, again at 2 p.m. BST. So please do join us to continue this conversation with members of the Global Mental Health Action Network. But for now, thank you again to all of our panelists. Thank you to everyone who's contributed to the chat. This will be video recorded, so you can watch it again afterwards and take copious notes, I hope. But for now, thanks again and goodbye.
Thank you. Thank you very much.
Thank you.